I've got 10 questions here to help you with case conceptualization and your hypothesis in family therapy. I'm pretty sure that these 10 questions are really going to help you think differently about family systems and family therapy, because working with families, it sometimes feels like you're drowning in information, trying to track multiple relationships, personalities, conversations, all at the same time. I know for me personally, it felt completely overwhelming, like trying to watch 5 TV shows simultaneously. And then sometimes it feels like you just get through the session and say goodbye, and then you're left with even more of an issue. What do you do with all of that information? How do you possibly synthesize it all to make sense of it and turn it into a decent conceptualization or hypothesis that is actually useful and can help guide your interventions and your treatment plans? I know when I'm stuck like this, I need a guide or a cheat sheet to rely on, and these questions are a pretty fantastic framework that help me organize all of that data and information into something meaningful. These 10 questions are definitely going to give you a clear direction about what to look for and how to think about things, but I also think you'll find them flexible enough to work with your style of how you do family therapy. I'm a big fan of structural family therapy, but also slip into Bowen family systems once in a while. And when I'm working with individuals, I'm more psychoanalytic. It's a bit of a hot mess up in here. But these questions definitely help. It's like Waze or Google Maps for conceptualization and family therapy. Each of these questions guides you to look at a different aspect of family functioning, and they build on each other, helping you to grow a really comprehensive picture of what's going on in the family. And don't worry about taking notes. I've got a free handout PDF thingy that I'll put in the comments below, and you can download that. If you're new to this channel, my name is Oliver and I'm a licensed marriage and family therapist here in Los Angeles. I'm also a recovering clinical director, and I built and ran a residential treatment center for teenagers and families. Creating this entire treatment center was such a fantastic opportunity for me because I've got to create a family systems oriented approach to residential treatment center. I've worked with a lot of families using systemic principles, but I also had to train other therapists how to do it too. If you want to learn more about how to do systemic family work, check out Family Systems Step by Step. It's a new online course I created about family systems, and it takes you through a very systemic approach to working with families right from the very first phone call all the way through to what interventions to use and why, and it covers a lot of theory too. Before we dive into these 10 questions themselves, I want to share something useful. Having taught this framework to quite a few other therapists over the years, you don't have to use all 10 questions all of the time. Sometimes you'll focus more on certain questions based on what the presenting problem is and what's going on in the family. It's all completely fine. They're just a guidepost. The point is not to create a rigid checklist and fill in all of the blanks, but to develop a mental framework that really helps you organize what you're seeing and hearing so that you can make the most of it. Okay, so question number 1 is, what is the outward appearance of the family? On a general level, I guess I'm asking myself, is this a scene of chaos as the family walks into my office with coats and bags flying everywhere, or is it more somber and serious with no one making eye contact? As a structural family therapist, for me, I'm particularly interested in how the family physically arranges themselves in my office. Who sits next to who stays closest to me as the therapist. I didn't really pay much attention to seating arrangements early on in my career. I was far too preoccupied on the verbal content, the presenting problem, and trying to remember everyone's names. But today I am fully bought into physical arrangements that show up in the office that Minuchin talked about. A family cannot tell you about its organization, its structure, or the boundaries, but they often seem to show it to you if you're paying attention. So when a family comes into my office and sits down, there's usually this sort of unspoken choreography in seating positions that reflects relationships, alliances, comfort levels, and even who's got power. What makes it even more revealing is that families are under a little bit of stress as they walk in, so they're less likely to maintain their usual social facades, and that means that they're choosing where they sit unconsciously, which is a good thing for us because we get to see that. Are parents sitting together, presenting this united front, or is there a child wedged between them, perhaps literally taking on the role of a mediator? Is someone choosing to sit apart from everyone else? And what might that tell us about the family system and their role in the system? Question number 2, what is the cognitive functioning in the family? So when we talk about cognitive functioning in family therapy, we're really asking, how does the family communicate? Not necessarily just the words they use, but the entire package of how they share information or don't share it with me as a therapist and each other. So some of the core questions here are: how clear is communication? Is it direct or indirect? Who talks to who doesn't talk to who, and who talks on behalf of someone else? So I was working with a family once, and one of the parents would tell me, "We're really upset about her grades." And I'd be wondering, well, who exactly is we? The dad sure as hell didn't seem at all concerned about grades. And secondly, upset, is that actually on my feelings wheel? Is that a clear and descriptive feeling? This is a kind of indirect, assumptive communication, and I think it often signals deeper issues in family functioning. Talking on behalf of someone else indicates some level of intrusiveness if you think about it, or at least very porous boundaries. I think of clear communication as putting in a new set of lenses. You can see exactly what's there and it's all in technicolor and in focus. And when a parent says, "Johnny, I'm angry at you because you said you'd be home by 9 and it's now 10:30. I want you to tell me exactly what happened and why you didn't call." Everyone knows exactly what's happening, what needs to be done, very clear communication. But many of the families that I work with are trying to see through dodgy old contact lenses or smeared glasses. Their communication is vague, indirect, and laden with hidden meanings. So masked and indirect communication is just exhausting. And the longer I do this work, the more sensitive I am to it. The other week, I asked a client what they wanted my help with, and 15 minutes later, I had to ask for the third time and obviously process why I was asking for the third time, because they still hadn't answered the question. And in another family I was consulting with, a 12-year-old daughter was not allowed to go to summer camp because she did not get straight A's. On the surface, that seems like quite a clear consequence for not getting good grades, but it's actually a really distorted way of communicating discipline. So I could understand, if you get good grades, we will send you to the summer camp because you'll have earned it and you'll have worked hard. It'll be a reward. I could also understand if summer camp was taken away because she broke curfew 3 nights and was out doing drugs with her friend. Please, hopefully no 12-year-old is doing that. To take summer camp away for not getting straight A's is a really confusing message. So the clear communication was, you need to get better grades, obviously, but there's also some very murky underlying message like, we don't really want you to leave home, or we're looking for an excuse to keep you here with us. It's a bit of a double bind. That's where you get a spoken message that conflicts or contradicts an unspoken emotional message. It really leaves the kid feeling confused. Question 3, what repetitive, non-productive sequences do you notice? So what we're looking for with this question is those predictable patterns of interaction that keep on showing up. It's not quite the same as what does the family keep fighting about, although that could be part of it. We're looking for patterns of interaction. And patterns are like a well-rehearsed TikTok dance video that families do, except nobody's having any fun. Nobody really chose the choreography and the song is awful. They're simultaneously visible if you know what to spot, but are also completely out of awareness for the family themselves. So an example that I see all the time is like a teenager starts acting out and dad comes in hard with consequences, but then mum jumps in to protect the teen. So dad feels undermined and backs off. And because dad backs off, the teen's behavior gets worse. That's a loop and a cycle. And breaking those kind of rigid patterns is often the key to creating change in families. But first of all, we have to see them and spot them and really get clear on what they are. So that family that I was consulting with had a pattern in which, as soon as any two family members started to have a meaningful conversation about conflict, especially if it was between the parents, one of the kids would swoop in to rescue or back someone else up. And what that really did was prevent anyone from having any resolution of conflict or disagreement. Parents in particular never got to finish a conversation, conflicts never got resolved, and underlying tensions just kept on building. Question 4, what is the basic feeling state in the family and who carries it? What we're looking for with this question is the emotional climate of the family. In family systems work, we'll assume that often only one of the family members is going to be really expressing this emotion. Could be depression, anger, or anxiety. But when you look closer, you'll actually find that that emotion is shared throughout the system. Like one person becomes the designated spokesperson of this feeling. And that is why we call them the identified patient. It's just that one person who we can identify who is carrying all of the symptoms or all of the feelings. So when I get a call to work with families who have an angry teen who's acting out, I would say that 70% of the time, I would predict that parents are really not getting on and are having conflict openly or discreetly or just avoiding conflict that really needs to be aired out. And the teen is manifesting that and showing the family's anger and resentment. Question 5. What individual roles are reinforcing family resistances and what are the most prevalent family defenses? This is not particularly a very structural family systems question, but it is a systemic one. In individual therapy, we're more tuned to spotting defenses. So my psychoanalytic training knows that defenses are unconscious ways we protect ourselves from feelings. Even if intellectually we know that having that feeling and processing it is going to be a good thing. If you've worked with someone individually, you've probably had that moment when someone is about to have a feeling or tell you a feeling, or you offer an interpretation that links that thing they told you about their father with what's going on in their current relationship with the fact that they were late to your session. It's like the trifecta of a perfect interpretation and you nail it and your client cracks a joke or changes the subject. That would be a pretty typical defense that someone has to not have the feeling that your interpretation was actually designed to make them have. Individual family members, of course, will have those sort of defenses too, but to make family therapy even more complicated than it is, family members also act defensively to protect the status quo of the entire family. And again, even if they know that not doing it might be more helpful. One of the ways to think about defenses in families is to think about those roles that Virginia Satir gave us. These are these kind of brilliant descriptions of family roles like the distractor, the blamer, the placator, the sort. They are ways or roles that family members help the entire family and themselves avoid uncomfortable feelings. And if you really think about it, roles are often encouraged or supported by other family members. So the hero or the mascot will get praised for their roles. And the placator is probably that go-to person when people are in conflict. If you don't know those roles, here's a rundown. The placator is all about keeping everyone happy at any cost. They're the ones saying sorry when nothing's wrong, they're taking the blame, they're keeping the peace, constantly checking if everyone's okay, and they give up what they want just to maintain peace for everyone else. The blamer is the finger pointer, right? They've got this amazing ability to find fault in everyone else and everything else. They're often the loudest voice in the room, and all that criticism is usually hiding something or avoiding something. The computer is that family member who responds to emotion with logic. When everyone else is upset, they'll start reading the dictionary. No, they'll start quoting statistics or telling you about a research study they read. It's like they're trying to think their way out of feelings and help everyone else do the same too. The distractor is the family member who just can't tolerate any tension. The moment things get serious, they'll crack a joke, change the subject, sometimes even create a crisis to pull attention away from what's going on with other people. And the leveler is actually our healthy communicator. They can tell you how they feel in a way that matches what's actually going on. And what you see is what you get with them, which is pretty rare in dysfunctional family systems. All right, question 6. What subsystems stand out in this family? Now, every time I talk about structural family systems, I launch into my analogy of a family being like a company, and I'm going to do it again. So a company is made up of a bunch of individuals with leaders or CEOs that have more influence or power. And if we were to draw an organizational chart, we'd put them at the top with people with less influence or less power underneath them. And a company also has different departments: marketing, finance, research. All of that is true for a family to varying degrees. In families, caregivers should be at the top of the organization chart, which we call a family structural map. And if there's more than one caregiver, that would be the equivalent of talking about the C-suite of a company or the vice presidents and senior vice presidents. But in family systems, we also call that a subsystem. A subsystem is more than one person in any group of family members that work together or are in agreement with each other about their roles. Subsystems are separated by boundaries, which are really just the implicit rules, the functions and connections that govern how that subsystem operates. Here's an example. When you go to the movies, you're in the subsystem of the audience. There are implicit rules that basically state that you're not going to be on your cell phone and have conversations. You're going to sit in the dark and listen. Without even knowing it, you're in that subsystem with other people and you're agreeing to and hopefully abiding by those rules. Usually people collaborate in a broad sense when they're in the same subsystem. So sitting in the movies in the dark, being quiet. That being said, two parents who absolutely hate each other and are divorced can still be considered to be in a parent subsystem because they're in agreement on and collaborating, hopefully, in their role as being parents. Same with siblings who hate each other. They're still agreeing to be kids. What we do not want to see is kids who are in the sibling subsystem act like parents, help keep the peace, keep track of money, make sure mum's okay. That isn't in the rules of being a kid. And similarly, we don't want parents acting like kids. Question 7, who carries the power in the family? Power shows up in families in all sorts of subtle ways. Who makes the rules? Who decides how time and money are spent? Who gets attention? The positive attention and the negative attention, that has something to do with power. I think power in families shows up in 3 areas: money, time, and communication. Who controls the finances? Who decides how family time is spent and whether it's spent together or separately? Who conducts the flow of communication? Who gets to speak about certain topics and who gets silenced? Sometimes the person who appears to have the least power, like a child with behavioral issues, actually holds a lot of power and influence, and you'll notice that the entire family changes their routines around this kid. So don't assume it's the parents, even if you've got a parent who is doing all of the talking, taking up a lot of space. Because if that session stops when one of those kids storms off in a tantrum, then I might consider how much power that child has. It's certainly enough to end the session, certainly enough to get mum and dad out of the room chasing after them. So don't assume it's parents just because they're the oldest. Question 8, how close are people in the family? So this is all about proximity and closeness, and it's multi-layered. But what we're really talking about is boundaries. I think boundaries go around feelings, individuals, and subsystems, and families. Damn it. Boundaries around feelings. I'm asking myself, to what extent can each person in this family have their own emotional experience, or are feelings shared and spread? Porous boundaries. Or the opposite, which would be rigid boundaries, and nobody expresses any feelings whatsoever. Boundaries around individuals, I'm sort of asking, are people allowed to be an individual as well as part of the family? So are children allowed enough psychological autonomy? Can family members, and especially kids, think differently from other family members without causing a crisis? Or does everyone have to think and feel the same way about things in order to keep the peace? So it's about individuality. If the parent doesn't have a healthy boundary around their self and they still need to be parented, it's incredibly difficult to allow those children to develop separately from them. They will need that kid to stay close and meet their emotional needs. When it comes to subsystems and boundaries, the boundaries between two subsystems, I want to know if they're distant, close, enmeshed, or intrusive. So in my family systems step-by-step course, I've got this whole module talking about the distinction between intrusive and close, because we tend to be quick to label people as being enmeshed, and really have to know the distinction between being intrusive versus enmeshed. Intrusiveness has this element of control in it, and that is a big problem for children who need psychological autonomy to develop into healthy, happy young adults. Control means that they're not given that space to do that. Question 9, what part of the life cycle is the family experiencing? Obviously, every family we work with is different, but there are these sort of universal stages that most families go through. And each stage brings its own unique challenges and transitions that families have to adapt to. When a couple has their first baby, for instance, they need to transform from being partners into being parents. And when those babies become teenagers, those parents need a whole new set of skills. And when those teens leave for college, the whole family has to adapt and change once again, which may require people to adapt, change, and learn new skills even. It's very common to find that someone in the family develops symptoms during these critical, universal transitional moments, particularly if a family cannot adapt or grow at each of these phases, right? So we need families to be flexible and adaptable, and when they're not, symptoms pop up. If you're still watching, I'm going to assume you quite like family systems, and there is another case conceptualization video somewhere around here, and a child starts having a problem right when their sibling leaves for college. This is a really good question to think about. The final question is, what are your personal reactions to the family? I think one of the most powerful tools we have as therapists is our own emotional response to what's happening in the room. And I've learned that my gut feelings, my associations, which includes frustration and anger, can provide valuable information about what's going on in the family system. I told you that I'm a bit of a hot mess of psychoanalytic and systemic thinking. I have some training in modern psychoanalysis, and that encourages me to assume that all feelings I have in the room are induced by the client, and it's a form of them communicating to me. Our countertransference is data. So when you feel overwhelmed in a session, that could be because it's an overwhelming family, but it could also be that you're feeling someone else's overwhelm. You obviously have to be very aware of what's going on in your own life, what you're feeling at the start of the session to notice what changes. But when you err on the side of your feelings being induced by someone else in the room, it's a really good rule of thumb, and I think very useful. When you're working with families, the other thing to notice is if you're being pulled into coalitions or alliances or triangles. And this is something I point out way too often with associates and trainees. It's so easy to be pulled into the system if you're not aware of it. So one of my associates quite innocently passed a message from a parent who called before the session with the kid. I pointed out that that was a triangle. First of all, it wasn't encouraging clear and direct communication between two people. We now had someone, passing a message on. But being the messenger means that you're sucked into the system. And when that happens, it's really hard to remain objective and to think clearly about people, noticing who you spend more time talking to and who you avoid, noticing who you're sticking up for or want to stick up for versus who you want to really get into and beat up. All feelings information that are telling you about the dynamics that you're potentially being sucked into. If you do think you're being sucked into something, it's totally okay. I would suggest you get some consultation or call a friend, but not the end of the world. But I think the takeaway for me is, what are you feeling? What does it mean about the family? And what are your reactions telling you about what's going on with the system? All right. So those were those 10 questions. I hope you find it useful. I'll put a link to the PDF below. And please, please, please check out Family Systems Step by Step if you are at all interested in family systems theory.